Have you ever woken up tired? Do you have brain fog? Do you not perform like you used to? Are you an athlete and you're not able to obtain the weight or the times that you used to be able to? Have you gone to a doctor, had an exam, had your labs run, and have the doctor tell you that everything looks okay even though you know you're not okay? There's a difference between optimal and disease. In the next 10 minutes, we're going to discuss the difference in lab values being pathological versus thriving and optimal. I'm Dr. Krugly. I'm a board-certified chiropractic sports physician, and I'm a diplomate in sports medicine. I have extensive knowledge in functional medicine and nutrition, and I would like to explain the difference between lab values being pathological and being optimal. Most physicians are trained to look at lab values from is there a pathology, a disease, or is there not a disease on this lab work? There's other values there that are equally as important for most patients. Chronic disease in general takes 7.5 to 10 years to develop. And in a time frame, if we're able to see these subtleties, these differences in the labs, it's much easier to reverse those numbers before they become pathological. What I mean by that is, if we start to see deviations in A1C and fasting glucose, insulin, it's easier to bring the body back into homeostasis and optimal functioning before the patient develops full-blown diabetes. Once a patient has diabetes, it is possible for them to normalize their physiology, but that swim is a little bit harder. It's a little bit more upstream. A typical lab value that's ordered by physicians is going to be TSH. TSH is thyroid stimulating hormone. By traditional values, normal is going to be somewhere between 0.5 and 4.5, about, depending on what lab you're looking at. I find most patients function better somewhere between 1.8 and 3.0. For fertility purposes, I want my patient to be at about 2.5. And those subtle changes in numbers can be the difference between getting pregnant or not getting pregnant, maintaining a pregnancy throughout the entire term, or for the non-pregnant patient, it could be the difference between having brain fog or feeling normal. But that's not where the story ends. There's free T3 and total T3, free T4 and total T4. Free is going to be the amount of available hormone. Total is going to be the amount of the hormone in the body. You can think of reverse T3 as a placeholder for the receptor. Binds with the receptor on an organ, but doesn't stimulate a process, so in effect allows the organ to take a metabolic break. TPO, thyroid peroxidase, thyroid globulin, those are two antibodies that are traditionally tested for when we're looking for autoimmunity. A side note, autoimmunity is like a mouse in a house. If you have one, you probably have others. Hashimoto's is the most diagnosed autoimmune disease in the world. And yeah, if you have one, you have others. There's a connection between autoimmunity and allergies, eczema, asthma, like all of those things, that's a triad, and all of those things usually run together. Additionally, there's other things that can affect the thyroid, such as blood sugar, and we'll get into that. Traditional lab values. The way a lab sets their values is they take a sample of the population in their area and they set up a bell curve, a statistical analysis of what they would consider normal. And if you're within that bell curve, you're rated as normal. And obviously, if you fall outside of that bell curve, then we start looking for other indicators that there could be a pathological process going on, a disease. There are some arguments in the functional medicine world and natural medicine world along the lines of, 38% of Americans are pre-diabetic, 14.9% of Americans have diabetes. Currently, this is in 2026, the making of this video. Most American adults are taking 1 to 4 medications. So if this is the sample population we're deriving our numbers from, are we sampling from a healthy population? Other differences in labs could include where the labs are drawn, where the data is collected from. For instance, if you look at a cholesterol panel in California versus a lab in Louisiana, the numbers are going to be different because the sample is going to be taken from a different population. There can also be some differences depending on what instruments the labs use. But in general, there are some values that I find and the functional medicine world has found to be very valuable. And across the board, most patients do better with these ranges tightened up just a little bit. Iron and ferritin. A couple things about iron and ferritin. Iron and ferritin are used by viruses during infections, and an infection can artificially raise or lower your iron or ferritin. So when we're looking at these values, there's always that to consider. Is there an infection? Ferritin specifically, I like to have that be somewhere between 40 and 100. And the time at which the lab is being drawn is important, because if this is a female patient and they're close to menstruating, then their value should be above 40, because what that means is that's going to be their highest ferritin at that point, right before they menstruate. And so what that means is if it's at 40 or maybe just below, while they're menstruating, it dips way below 40. So knowing the time from when the lab is drawn is important. And as I said, ferritin is an acute phase reactant, meaning that it will raise during infection, and ferritin and iron can both raise or lower during infections as well. Vitamin D and B12. Deficiencies in vitamin D and B12 can both affect mood and energy level. Vitamin D should be thought of more as a hormone. I like my patients to be somewhere between 40 and 80. Believe it or not, that's actually kind of hard living in Las Vegas. I know it sounds counterintuitive because we live in a desert, but the majority of patients that I test for vitamin D are deficient. Another thing to consider when it comes to vitamin D, it's a fat-soluble vitamin. Your gallbladder is the organ responsible for fat metabolism and proper absorption of fats. And so if the patient has a deficiency in vitamin D, they could also have deficiencies in other fat-soluble vitamins, and that could indicate that there's a gallbladder issue. B12. B12 is a vitamin that I like to see patients no lower than 600. If we start to drop below 600, neurological symptoms can manifest. Energy is usually the thing most patients feel, but this can also affect cognition, motor skill, and other neurological domains. Blood sugar is probably one of my more favorite topics. Blood sugar falls into two categories: hypoglycemia and insulin resistance. When we have insulin resistance, what that means is blood sugar is usually resting relatively high. When we have hypoglycemia, what that usually means is blood sugar is resting relatively low. Changes in blood sugar affect hormonal status, energy levels, cognition, and long-term changes, long-term dysfunctions with blood sugar lead to most chronic disease. We're going to dive deep into blood sugar in some subsequent videos. Stay tuned. Inflammation markers. C-reactive protein, homocysteine. A C-reactive protein should be at 1 or below is where I like to see my patients. Anything above that, and I'm looking for other signs of inflammation, such as homocysteine. The thing about homocysteine is it's a very sharp molecule. Homocysteine has the ability to disrupt the endothelium. That's the lining of the blood vessel. All heart disease starts and ends in the endothelium. What that means is anybody with cardiovascular disease has an issue with their vascular endothelium. And as I said, homocysteine is a sharp molecule, so when it's elevated, when methylation is not happening properly, then there is a chance that we disrupt the endothelium and heart disease becomes a problem. Other inflammation markers, like I said earlier, ferritin can be an acute phase reactant and show inflammation. So when we're looking at lab work, like any other type of test run, it's really important to understand what the patient is going through, because what might read normal for one person might be a clue as to what's going on for another person. When I'm reading lab work, I'm picturing the patient, or I have the patient in front of me, and it's my job as a clinician to link what I see in the labs to the story the patient's telling me and the story the body is telling me. For instance, a patient comes in and they have brain fog, fatigue. It's a very common thing, that's why I'm talking about it. And they also have thinning of the lateral 1/3 of the margins of the eyebrow. And they have dry skin. They have a slowed Achilles reflex. These are all signs of thyroid dysfunction. Now, if we combine that with a TSH value that's above 3.0 or below 1.8, that's confirmation something's going on with their thyroid. Lab values are relative to the patient that's in front of you, and there's more to a lab value than is this pathological or not pathological. In summary, more than just does this patient fall in or out of the bell curve, we have to take the total picture into account. What are the patient's symptoms are presenting with, and are the values for that patient relatively optimal or a deviation from optimal? When we look at values under this lens, we get a clearer picture of what's truly going on for that patient. What are some things you can do to make sure you're getting the most out of your blood work? Ask your clinician to review the actual numbers with you, and not just from a normal and abnormal standpoint, but what do the values actually mean to you or for you? If you haven't had a competent, thorough exam with a full lab panel, this is a list of the most common analytes I look at when I first start working with a patient. Out-of-pocket expense is going to be somewhere around $1,300, and through my office, it's going to be somewhere around $150. I've negotiated some really great prices through local labs because of the amount of blood work that I run and the type of work that I do as a clinician. If you liked this clinical breakdown, please click subscribe. If you have any questions, put them in a comment section. I'll get to them as soon as I can. And if you'd like this type of workup, call for a consultation. Consultations are free.